Hello, and welcome to Courageous Doctors, the health show for you and your doctor. Today we will discuss Obamacare updates, other healthcare news, and health and safety tips. Now let's begin. CNN reports on the Senate repeal of Obamacare that failed even after the House passed its vote. Now, as you know, there's less than a month left in order for the Senate to take another chance at passing this, or else they'll be done for the year. Most people don't think it's going to pass any other attempts, and most people don't think the Senate is even going to take up another health care bill. So it looks pretty much like we're stuck with Obamacare for another year. Fox reports that more insurance companies are pulling out of Obamacare. Anthem left Nevada, leaving 14 out of 17 counties without coverage. Anthem left most of California, and in fact is now only in 11 states. And I believe just this week, 70,000 people in Virginia are now left without an insurance company on the exchange. And some of the things that the senators want to do is to possibly let those people in Virginia go on one of the federal insurance programs temporarily. And the other thing, because of the instability in the insurance market, because the insurance companies are just unsure about whether patients will get subsidies from the government to afford the premium, or whether they, the insurance companies, are going to have to charge higher premiums to people that aren't on subsidies. Because of this difficulty in not being clear, the Senate is seriously considering this week continuing the Obamacare subsidies so that the insurance companies at least know that most of the people on the individual market will be able to afford their premiums. Let's see. The Wall Street Journal added to this that premiums on the exchanges are likely to go up 30%. But again, if the government is paying for the subsidies, the government's simply going to pay for the increase. Now, let's see. Fox also says that although the insurance rates are increasing, this is very interesting, they're actually limiting the care in terms of what hospitals and doctors you're allowed to go to. Insurance companies behind the scenes, and they're all doing this, are trying to find the best possible number of hospitals and doctors who will give them the cheapest care and spend the least of their money. It doesn't mean it's good for you. It doesn't mean you'll have your hospital or doctor. Doctors are now being rated. It has nothing to do with the quality of care, although the insurance companies claim it does, but we all know it doesn't. It has to do with who can spend less of their premium dollar. So this is going on behind the scenes. This is what Fox News is talking about, and I'm merely reporting that. And Fox News goes on to say that 53 million Americans have chronic illness and find it difficult to get insurance money for tests, procedures, and treatments. In fact, what really happens is the insurance company will make them use cheaper drugs and not allow treatments. And then maybe after so many years, we'll finally let them get what they need. Then they're sicker and, in fact, cost more, which makes no sense. And this is what Fox News is reporting on, when in fact, if they had just given the patient what they needed and listened to the doctor and given the patient what they needed, they would have been better off. But, good luck there. Those days are gone. The Journal of American Medical Association, JAMA, a Harvard professor said that if we think this is bad now, it's going to get even worse when the next stage that the Senate is considering and Congress is considering is to pay Medicaid on block grants like they used to, with high-risk pools, to take the high-risk pools out of the major Medicaid funds and have the block grants fund most of everything else. And Harvard School of Public Health published an article in JAMA saying that a lot of care is just not going to be covered. One of the reasons is most of the chronically disabled are on Medicare and Medicaid, and there's just not going to be enough money to handle it. In fact, a quarter of the Medicaid recipients, Medicare and Medicaid pay for most of this long-term care and chronic illness and all. but a quarter of the Medicaid recipients are actually spending 2/3 of the money. So, you have a block grant. If the block grant, unless you really have separate risk pools, even for these Medicaid patients, because all these poor chronic patients are going to be on Medicaid at some point, you don't have enough money in the system. Canada even reported, I believe I reported this on a previous news show, that Canada said they've been under block grants now, and their provincial governments are really hurting. The regional provincial governments simply don't have enough money. And the national equivalent to White House, the federal government of Canada, doesn't give enough money to the provinces to keep up with healthcare costs. As you know, even Canada, which has much cheaper healthcare than us, they said they had a healthcare inflation of close to 12%, similar to ours, whereas the normal inflation is 2 or 3%. So healthcare costs go up at a much higher rate, and this has been one of the big problems. In fact, just to go off aside a little bit, this has been a very exciting week for healthcare with a lot of pundits, a lot of congressional hearings. They're really trying, I don't think they're going to do anything, but they're really trying to see if they can at least stabilize the insurance market at the beginning of this year, of the new insurance year now. Even though they're probably not going to repeal Obamacare, at least pay the subsidies. They're considering something called a reinsurance, where they can go in and help the insurance companies that have made great losses by not having proper premiums or having too many sick patients to cover, and to have these high risk pools, et cetera. They're looking into these just to stabilize the market, because you can't keep having all these insurance companies dropping out of the exchange market and expect these people to get care. It's just not going to happen. Let's see. Well, this is a very important part. CNN reported that in Florida, this is just really terrible, people. This is horrible. And this is the biggest fear. When you have government administrators making decisions about your real health, they came up with some cockamamie formula that they claim worked, and they ended up throwing seriously ill kids in Florida off the Medicaid program, putting them onto alternative, I guess, Medicaid-like programs. Maybe it was all Medicaid, where they didn't get services they needed. Some couldn't get heart surgery, just horror stories. Look back at CNN. They went through all of it, just one horror story after another. I mean, how stupid can they be? I'm glad I don't practice in Florida. The pediatricians were livid. Finally, I think the governor turned a lot of this around, and now these kids are getting services again, or at least attempting to. But, you just don't fool with these kids and adults, your grandmas in nursing homes and grandpas, people with chronic diabetes and illness. Healthcare is scary. It not only can bankrupt you if you don't have the right coverage, but even if you can't even get care for these chronic disabilities, your medicine, procedures, surgeries you need, I mean, you're killing people, scary stuff. So I always have a lot of trouble. I know the Center for Medicare and Medicaid in Washington is trying to do the best it can, and the individual states have to run their own programs. But, please, for once in your life, try listening to the doctor who's taking care of these patients, and stop building a wall between you and the doctor, and maybe we can get the care these kids need. Don't throw people off care. I see it all the time in my office. They come in, hey, Barry, I'm sorry, I don't have Medicaid anymore. I got put off. What do I do? Well, I'm not going to let them go without treatment. I'm going to always take care of it. I feel sorry for people. And I just keep saying to myself, why would you, you're sitting there throwing people off plans. I realize some of the people may not make it down on time to fill things out, but, don't drop their care. We need a better plan. But let me move on. Getting carried away. Let's see. Oh, this is interesting. Trump's White House is going to allow New Jersey City hospitals on Medicare to get some of the money that was designated only for rural hospitals on Medicare. So now some of these city hospitals can pay bills. Remember that the hospitals are hurting too, because Governor Christie decreased the amount of charity care they're allowed to have, and if they can't get the Medicare funds, these hospitals will go under. Washington Post, generic drugs are a real problem. They said 9 out of every 10 drugs that we get are generic drugs, and there's nothing wrong with that. I'm on generic drugs myself. But according to the Government Accountability Office, 300 out of the 1,441 generic drugs have greatly increased their prices. So what's the point of having a generic drug if it's going to increase its prices? But, and this is interesting, I did not know this. The Annals of Internal Medicine reported that 1/2 of all generics are actually only made by 2 companies. So you're not surprised to see price hikes when only 2 companies are making these drugs. Fox said that the SNAP program, that's the food stamps. It stands for Supplemental Assistance Nutrition Program. The SNAP program will not be given to you if you can work unless you have children. So I guess the point of it is the government doesn't want to give you food stamps if you can work so it can save money. But there's a lot of starving people out there. I have a lot of friends that work in these, they volunteer in food banks, and Lord knows we're trying to get lunches into the kids. There's a lot of Americans that are hungry. These kids are hungry, elderly, money's tough. I think we're still in the recession. I don't care what anybody says. Maybe the stock market's doing good. People around me are still hurting. And people are hungry. And why would you fool with their food stamps? Are people really, how many people are really thieves that they're going to steal government food stamps? If somebody has to ask for food stamps, maybe they really need it. I don't know. Just a thought. Okay, the New York Times said that President Trump is appointing the former Georgia Health Commissioner, Dr. Brenda Fitzgerald, a gynecologist, appointing her to the new CDC director, replacing Tom Frieden. Tom Frieden, who did a very nice job, I think, as CDC director. He was formerly the health commissioner of New York. It was very good. I knew his work back then. And it looks like this person is going to do a nice job also. The Star-Ledger reports that, President Trump, as you all know by now, has declared the opioid state of emergency. And I think this is one of the nicest things that Governor Christie has done, is to really impress upon President Trump that the opioid crisis is major. And we really need to have funds to really be able to tackle it. And by declaring it a public emergency, now states will be allowed to use money from the Federal Disaster Relief Fund, and maybe we can move on this faster. Let's see, Star-Ledger said, this is interesting, I did not know this, that Governor Christie signed into law Peggy's Law. Peggy, this is a very tragic case. She was allegedly abused. I don't know if it was ever proven, but allegedly abused, that she was beaten up and killed and left neglected in a nursing home. Just terrible. And so they named this law after her. Basically what it says is, whereas you formerly, if you had an abuse, you either didn't have to report it, or you could report it to the ombudsman, who works out of the government, that's supposed to be there for people in nursing homes and psychiatric hospitals and what have you. Now it's mandatory. You have to report it to the police, and the facility and the health employer can be fined heavily. I think $2,500 per employee per not reporting. It has to be reported in a timely manner, and I think it's a good thing. Let's see, the Star-Ledger. This is interesting. Do you remember back the Ebola crisis, where this nurse coming from Doctors Without Borders, she comes in, she made the misfortune of coming into the Newark airport. She was actually, and I didn't know this, cleared by the CDC, which I didn't know, according to the Star-Ledger. But Governor Christie picked her up and put her into a Ebola confinement tent in one of the hospital parking lots. And she was there, and it was all over national news, and let me go, I don't have Ebola, why are you keeping me? And she ended up suing. And now apparently she won in her lawsuit, and now in future Ebola epidemics, I guess, or any other epidemic, the person that is being involuntarily committed to stay in some quarantine tent now has a right. They have a right to both get it in writing from the state while you're holding them, and to appeal it to a judge rather than just be there helpless. And the court and the judge has to hear their appeal. In this case, this woman had very bona fide appeal, and she won her case. Now, the Star Ledger, you probably all know this by now. Governor Christie raised the smoking age in New Jersey to 21 years old, and New Jersey is now the third state to do that. Bloomberg News says that the Federal Drug Administration is now using a law that was actually passed in 2009 to decrease nicotine content in cigarettes, and that law was called the Family Smoking Prevention and Tobacco Control Act. CNN says that the United States Drug and Food Administration is cracking down on the illegal use of stem cell treatments that are harmful and unproven. Now remember, most of the stem cell treatments, the U.S. Drug and Food Administration says most of them do a nice job. It's a few bad apples, but people have gotten hurt. And listen to some of this. This is just crazy. In San Diego, stem cell clinics were using smallpox in their mixture. A New England Journal of Medicine had reported that 3 women were left blind after stem cells were injected into their macular degeneration in the eyes. Other reports of injecting non-sterile solutions into the spine, some crazy stuff. So believe me, I understand the need and the urgency that people want to have stem cell treatments. My mom had debilitating Parkinson's disease. It had advanced quickly before her death, and Dad and I were, and this was going back, 15 years or so. Even at that time, we went down to Johns Hopkins and tried, desperately to see if any stem cells could fix the damaged brain cells in her brain. I understand completely the urgency you have for your loved ones, but please, people, make sure it's a safe clinic. It's not worth dying in some clinic that's not safe. This is exciting. The FDA approved what's called CAR-T therapy for leukemia. This is a new kind of thing. It's been researched in the past, but it's just newly approved, where you take the leukemic patient's T lymphocyte fighting cells, immunity cells, and you change them, alter them genetically, and change them to kill the cancer cells. They're injected back, and of course they're safe because they belong to the patient. It's their cells, but they just now kill the cancer. It's a very exciting treatment. We'll have to see where that goes and if that will have far-reaching beyond that. All right, let's move on to other healthcare updates. This is, of course, very tragic. We're now in the middle of horrible hurricanes, 2 major Category 5 hurricanes. We just destroyed Houston, Texas, and still is recovering from flooding. And as we speak now, is heading towards Florida and is just going to devastate these cities. These areas always get hurricanes, but these are very, very powerful monster storms and already it's like a refugee camp. I mean, you've got millions of people being taken out of their homes and put into shelters and leaving the state and the area. I mean, this is just horrific. And this is the other part that is becoming, initially in search and rescue and stabilization and having food and shelter, that's all the Red Cross sort of stuff. That's always the most important thing. But as a medical reserve first responder myself, what a lot of us are interested in going beyond is, what are the healthcare consequences of this? What diseases are in the water? What chemicals and poisons? You have chemical plants, and this is what the CNN was reporting on. You have chemical plants dumping gasoline, heavy metals like arsenic, lead, mercury, chromium, cadmium. You have E. coli. You have sewage waste plants, typhoid E. coli, cryptosporidium. I mean, these people that are flooded in this horrible storm and lost their homes and everything else are now being poisoned in the water around them. And we, as first responders and healthcare workers, we not only have to aid the Red Cross in helping these people to find shelter, but now we have to be prepared to treat their poisonings. And the people that do this for, the real, the first responders, they themselves have special ways of wetting down their clothes and getting all the poisons and disease off them. But these people that are just wading in the water, they have to be careful and wash the best they can. Now, it's not only the hurricane in Houston and Florida, but we've had other sewage sickness where we had E. coli poisonings. Fox News reports that a Nevada lake was near a waste treatment plant and got poisoned. And CNN had reported that Vibrio, in these same waters that are now threatened by these hurricanes, had already, because the waters are so warm, Vibrio, which is a very, very serious pathogen and can cause skin-eating sickness and sepsis and has killed people, it is infecting swimmers through their cuts, and it's also in raw oysters. So this Vibrio gets into raw oysters. And the public health in Alabama, and I'm sure it goes for the rest of the country, was warning against eating raw oysters. Let's see, recalls. Let's talk about recalls now. Some of these have already been cleared up. Some are ongoing. So just be sure you check with your local stores to make sure that the recalls have been taken care of. But the ones listed here, Fox News listed Trader Joe's had recalled breakfast sausages simply because they didn't label the content of soy in them. CNN said the yellow Maridol papayas from Mexico are poisoned with salmonella. Mexican papayas are poisoned with salmonella, so please be careful. CNN said Sabrett hot dogs and beef and pork salami have bone parts, so they're recalled because the bone parts got in them. And let's see, some more talk about diseases. The Infectious Disease Children's Journal, which is a journal I read, reported 3,800 cases of measles in Romania, and 17 deaths. My nephew, Jason Prystowsky, who works with the Doctors Without Borders all over the world, he has a wonderful lecture on YouTube, if you can catch it, and he gives a graphic depiction of where he would watch people from measles dying every day in third world countries, but we didn't expect them to be dying right in Europe, in Romania. We don't want them to die anywhere, but at least Romania, they could have vaccinated. Okay, the New York Times says that syphilis is going up. CDC had reported that. The Ledger says there's an increase in Lyme disease. This is interesting. The white-footed mouse is carrying Lyme disease, not just the deer. And because apparently we've had some bumper crops of acorns, so these mice have increased their population. They're eating well and spreading Lyme disease, spreading the good stuff. Fox reports a swine flu outbreak at an Ohio County fair. Yeah, people, please be careful. This is what happens. You get these county fairs, and we all love them. They're wonderful. But wash your hands. Don't kiss the animals. We get swine flu, that's pigs. We can get it from pigs. So these kids were pretty sick, so please be careful. Cyclospora, CNN reports, cyclospora is in our pools. It is not really killed by chlorine. It's from animals from people infected that, poop in the pool, and animals that poop in the pool. And, but cyclospora has also been found in imported produce. And I don't want to turn anybody off those great salad lovers, but basil, lettuce, cilantro, raspberry, snow peas have all had cyclospora. So be careful. CNN reports an increase of salmonella from pet turtles, and they're suggesting not to let the pet turtle in the kitchen where you're cooking. And CNN also said that the health department said, please don't kiss your pet chickens because they also have salmonella. This is scary. Fox reported a Connecticut man died from a tick bite that he got while gardening. This is not one of the more common tick diseases. It's one that we as physicians look for. It's called babesiosis. It's a parasite in the red blood cells, just like malaria. It's carried by the tick, and unfortunately, this man caught it gardening, and he died. Fox is reporting that an Indiana man is now in a coma from West Nile virus. So Indiana has West Nile in its mosquitoes. More than half of its counties, its mosquitoes have West Nile. This is about the time of the year we see a lot of West Nile virus, so we'll be watching that closely with Indiana. The Star Ledger said that this is fascinating. The DNA from a gene causing hypertrophic cardiomyopathy. Let me explain to you what that is. That's where one of the inner walls of the heart, near where the aorta, the main vessel bringing blood to the body, that gets very thickened, and it can close off and suddenly kill people when the blood can't get out of it. This is one of the main tests we test for to clear people for school athletics. It's one of the causes of sudden death in athletes, and we check for that. But a new gene technique called CRISPR, and I won't go into what that stands for, but basically it's like a pair of scissors that cuts out the bad gene and allows the embryo to continue dividing with only the good gene, and then it's reinserted back into mom. And supposedly it was able to cut out this cardiomyopathy gene, and the doctor involved, Dr. Metalipov from Oregon Health and Sciences University, there were a lot of people involved, but he was one of the main researchers. He said he hopes this goes to other diseases as well. I don't know if it's commonly being used now, it may still be in the research stages, but boy, imagine that you can find out what genetic diseases your baby can have and cut them out before they're born. That would be exciting. Fox News says that chronic fatigue syndrome, they discovered all these people that were, chronically tired and nobody knew why. They now have a test that, found that 17 messengers within cells, within the immune cells, which we call cytokines, that 17 of these messages were discovered, so that we now know who has chronic fatigue syndrome by seeing if they have these messages that are telling other cells how to react in terms of inflaming the body and making you fatigued, and may one day lead to a cure. So that's very exciting. CNN, this is very disturbing, says that colon cancer is on the rise in people less than 50. Young adults, young middle-aged people. We don't even test for those people. We don't screen at that age. What is going on? Is it their stress? Is it the way they eat? I don't know. But that's pretty scary. CNN says that, and this is an interesting thing, we all worry about eating disorders. It seems to be more common in women, but bulimia is one where, they have a craving for food and then they bring the food back up. And researchers who actually imaged the brain discovered that those brains work differently. Different areas light up. For example, the area of self-perception was not as well lit up. So these people have low perception of themselves, I guess, self-perception. But the areas that lit up more were emotional areas. So that makes sense. If you're the kind of person that's just going to crave food and eat a lot, and then, So it's interesting they're starting to discover actual changes in the brain. And finally, depression and suicidal thinking, phone calls to hotlines were increasing. This was the Ledger reported from Boys Town National Hotline. By the way, the number is 1-800-448-3000. And the Boys Town National Hotline, they said that all of us need to do a greater part. We need to look for changes in our teenagers, behavior, mood, not eating or sleeping, loss of desire to do things. Let kids know it's okay to be upset, and have designated family times in order to vent.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Berry in a professional and personal capacity for many years, and we are thrilled to be in his building. We are psychotherapists and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
Our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
Okay, now let's move on to health and safety tips. MedPage Today said that a study at a nationwide children's hospital in Columbus, Ohio, found that only 1/3 of the kids that had major anaphylactic reactions, anaphylaxis where you go into shock and you can die. I mean, just your heart stops, everything stops. I mean, you're literally dying. You're swelling up, your body's swelling up, you're dying, you're unconscious, and you have to give that EpiPen injection immediately, and then bring them to the hospital. These were children known to have this reaction, and only 1/3 of them got the EpiPen. I think the hospitals were able to resuscitate them, but that was very disturbing. New York Times said that the phthalates were found in boxed macaroni cheese, in the powdered cheeses, in these boxed macaroni cheeses. Phthalates, these are chemicals like you find in plastics. What are they doing in my macaroni? Boy, that's terrible. Let's see. CNN reports that there's been increased calls to poison control centers for dietary supplements. You don't normally think about this. Vitamins, various minerals, herbs, amino acids, homeopathics. But kids can get poisoned on this. Ephedra was taken off the market. We reported a lot about that years ago, where that speeds up your heart and can kill you. But there's other things that can speed up your heart. There's very powerful, very high dose caffeine energy drinks. There's Yohimbe, which has a lot of energy. You got to be careful, especially if young kids get a hold of these. Let's see. Fox reports that a teen, this is so tragic. Boy, the teenage girl was taking a bath, and like most teenage girls, wanted to text on her phone. The phone was not in the water. There was a frayed electrical recharging cord that was attached to the phone. She was in the water, and when she went to touch her phone out of the water, the frayed cord killed her and electrocuted her. My Lord, who would have ever thought? I mean, I'm just terrified. I can hardly even repeat that. Oh, boy. Okay, CNN said, this is another one. My patients love to come in with these fidget spinners. I never thought anything of it. Another crave, right? But apparently, and I did not know this, they can cause choking and battery fires. I don't know how the kid swallows this thing. It's just a little thing that spins around, and I don't exactly know where the battery fire is. I see them in my office. They're all playing with them, but let's see. CNN says, according to the U.S. Centers for Disease Control and Prevention, only 1/2 of our babies are being put to sleep on their back. I remember when all this came out, we used to always have a few SIDS every year, and we haven't seen it in a long, long time because kids are on their back. And I guess now people are getting lazy. I remember in the 90s, in the mid-90s, when the studies came out that children do not die, babies, newborn babies up for the first few months of life, they don't die if they sleep on their back, only on their stomach, and no one ever knew why. We call these crib deaths or SIDS, sudden infant death syndrome. But apparently we're getting lax, so we need to be more careful. Let's see. And also, the Academy of Pediatrics wants us, they have a reminder policy warning statement that the first year of life, you really shouldn't have any blankets or pillows in the crib, tight-fitting sheets, no extra sheets on there or anything. We try not to let kids suffocate or get hurt. Let's see, JAMA, the Journal of American Medical Association, mentions a CDC report Oh boy, why would anybody eat a mushroom in their backyard? Apparently, they had liver failure, they're dying from this. Apparently, they thought cooking the mushroom in your backyard was safe. I am not even going to comment on that. Okay, the ledger. This is interesting. Professor Robert Schmierling from the Harvard School looked at marathon runners who took only 2 ibuprofens, Advil or Motrin, I guess, every 4 hours, only 4 times during their marathon race, and they had problems with their kidneys, I guess because they were dehydrated. We know that chronic use of Advil or Motrin, not just Advil, any ibuprofen, any of these NSAIDs, nonsteroidals, some worse than others. I shouldn't have just pointed out two. I mean, all of them, nonsteroidals. We know they can affect the kidney, they can give you ulcers, and that's why, my doctors also that I see, prefer for me not to take for my bone or joint pain chronic NSAIDs unless I'm watching my kidney and preventing an ulcer. But I didn't realize that just taking them a few times like that would also cause a problem in these marathon runners. So that was interesting. I guess it's something we need to look more carefully at. Let's move on. USA Today says that the American Academy of Pediatrics is, again, I see this all the time. They're warning against trampolines. My patients are always, I just had a patient today. Great family, love them. Their kids are wonderful athletes, young kids, 13, 10, that age, 11. And they're on their way to a trampoline party. And mom doesn't like it, but the kid wants to go. It's a birthday party or something. So what are you going to do? But the academy says if you have to do it, make sure a parent's there, make sure only one kid's on the trampoline at a time, and make sure they don't do flips or somersaults. And of course, my patient, when I told him this, first thing, a lovely kid, but the first thing out of his mouth was, I'm doing flips. So see what happens. CNN says that according to the United States Consumer Product Safety Commission, amusement parks are seeing thousands of injuries. We've all seen this. It's horrendous. Oh my God, tragic. I think some have died or been severely hurt falling off these rides. Parents think the rides are safe. I saw a few documentaries on this, not related to the CNN reporting, that discuss the possibility, the idea that these are under local authorities. It's all regional and local and maybe some state input. So the Consumer Product Commission has no real, jurisdiction over local amusement parks. But the only advice to parents was, please be careful. Don't assume these rides are safe. Okay, CNN says that, this is lovely. There's new apps for dyslexics that are both audible. Dyslexia basically means that when you're reading something, the letters just don't make sense. So what they do is very interesting apps. They actually make part of the letter stand out so that you can pick up the letter better, and they recognize it. And also, some of these apps will actually read out loud while you're reading with you. They actually read the print and read it out loud, or will help you when you're writing, spell check and write correctly. I mean, some wonderful things. Some of the apps they mention, and we'll put it up on the screen for you, are Audible and Learning Ally, Bookshare, and LiveScribe, Echo Pen. But I'm sure there's many others. These are the ones mentioned by CNN. Okay, here's for some fun stuff as we come near the end of the report. Let's talk about eating. Healthy eating tips. Star Ledger looked at a study from Harvard that shows that a bad vegan diet, in terms of preventing heart disease, is really no better than just not having a diet at all. In fact, it's better to go on a common sense diet, like Grandma always told us to do, than to eat a bad vegan diet. So what's a bad vegan diet? It's eating refined grains, sweetened beverages, just because you're eating vegetables doesn't mean it can't be junky. So be careful. Vegan diets are fine, but if you're going to be a vegan, be it for other reasons. You don't need a vegan diet to prevent heart disease. A good South Beach diet, Mediterranean diet, any of these other, well worked out diets or many others on the market, will prevent heart disease and common sense approach. Vegan diet should be a philosophical thing because you simply don't want to eat meat. But anyway, let's see. The Ledger says that not all energy bars are healthy. And I've actually used this to tell my patients. It was a very interesting article. For example, you don't eat a chocolate energy bar. I mean, it's chocolate. If you don't care and you're not trying to lose weight and you just want a little pep before you go out and play with the guys or the gals, fine. But if you're a serious athlete and you're watching your intake and you don't want the chocolate. You want the 10 grams of protein. You want 4 grams of fiber. You want less than 3 grams of saturated fat. You only want 150 to 200 calories. They said also be careful, avoid palm kernel oil that's in yogurt, brown rice syrupy things, cane inverted syrup, and sugar alcohols like maltitol and erythritol. Those can just hurt your stomach. So, you really have to look, not all bars and not all of these energy snacks are the same. American Heart Association, and this is something, take it for, how you want to take it. There's a lot of coconut lovers. I just heard on the news coming into the office this morning that coconut oil is on the rise. They were worried about coconut oil because the hurricane in Florida might destroy some of that. But apparently all over the world, coconut oil is a craze and it's on the rise, and coconut milk. But the American Heart Association still says that coconut oil is high in saturated fats. It increases your bad cholesterol, low-density lipoprotein, LDL. It does raise the HDL because of its high lauric acid content. That's a healthy fatty acid. And so they simply said, look, just use it in a limited amount, for whatever reason you want to use it. They mentioned if you need a hard butter, and instead of hard butter, you want to use a coconut oil to get that harder taste. But just remember it's saturated fat and be careful. And the American Heart would rather you use olive oil or canola oil, but just be careful. Let's see what else we have. CNN says, getting kids to eat right. Back to school, this is perfect timing. What are some tips to get them to eat right? Well, don't bring home junk food. Let kids go to the marketplace with you. Pick out their veggies. I tell this to my patients all the time. Make them involved. They should be shopping with you, see the beautiful colors. Whenever I go shopping, I don't have to buy everything, but I love to look at the vegetable section. I find it exciting. It's all kinds of colors, natural stuff and all. Let the kids go. Let them pick out stuff. Let them help prepare the meal. And this is really fun. Make a game. I honestly, I'm going to try this with my own patients. I never tried it. Make a game. Like let's have a purple night. So we dress in purple and we eat purple peppers, purple cauliflower, purple potatoes, grapes, eggplant. Or let's see who's the strongest. After you eat your pea, let's see you flex your muscles. Trying new dishes like spaghetti squash or coconut or almond flour muffins. And basically just leave veggie snacks around. Now this is interesting, and we'll put this up on the screen. Foods with fiber, it says we should all shoot for 25 to 30 grams a day. That's adults for fiber, 25 to 30 grams. And it just gives an interesting list. CNN did this, a list of foods with fiber content. I honestly never really thought, we all know what has fiber, but I never thought about how much fiber is in these foods. I'll just go through some of them, and you can look at your screen. Okay, adding beans and peaches to salad. Apples have 4.5 grams. Bananas and oranges have 3 grams. Remember, you're shooting for 25 to 30 grams a day. A berry cup has 4 grams, pears 6, mixed fruit and nuts 4, cooked oatmeal 5, multi-bran bread 2, quinoa, which I like, I eat a lot of, has 3. A cup of hummus has 15 grams. Wow. Sliced avocado is 10 grams. Baked beans, 19 grams of fiber. This is all fiber. Black beans, 29 grams. Wow, of fiber. Black beans. Green beans, 3, and lentils, 16 grams. I love lentil soup. And they talked about foods that people do to fill themselves up, like Greek or Icelandic yogurt, avocado, red chili pepper, barley, salad, spinach, flax seeds. You know, from my baseball days, we all used to eat the flax seeds, sunflower seeds, whatever. And lastly, and this is really, really interesting. Listen to this, people. A new natural zero-calorie sugar from South America, a South American sunflower plant. It's actually an old plant, very known, but new to our market. It's called stevia, named after its founder. And in fact, there's a newer version called Eversweet, which will leave out, apparently it had a licorice taste, will leave out that taste. And it's already being used by Nestle's. It's in Nestea and Coke, Pepsi, and other drinks, and very exciting. It's an alternative to the artificial sweeteners. This is a natural sweetener. As always, we welcome you for joining our show. Please feel free to send in your comments, and we will air your comments on the next show. Again, my prayers are with the hurricane victims in Houston and those about to be hit in Florida. I also pray for the Senate that they can find a way to stabilize the insurance markets in the next couple of weeks. And may all of you have a enjoyable evening. Take care.